My kid has a serious sweet tooth. Is all the sugar they're eating the cause of their ADHD symptoms? Hi, I'm Dr. Keelan O'Connell, a board certified child, adolescent, and adult psychiatrist. Welcome to my channel. Let's delve into some root causes of ADHD. Before we go any further, though, let's clear up some of the most common misunderstandings about ADHD, because myths can do real harm. ADHD is not caused by bad parenting. Let me say that again. ADHD is not the result of poor discipline, inconsistent rules, or a lack of structure at home. Parenting styles can influence how symptoms show up in daily life, but they do not create ADHD. It's also not caused by eating too much sugar. Research has repeatedly shown that while sugar may affect energy levels or behaviors in some children, it does not cause the neurological differences that define ADHD. And finally, ADHD is absolutely not a sign of laziness. People with ADHD often work twice as hard to stay organized, pay attention, or regulate their emotions. What may look like a lack of motivation is usually a mismatch between the brain's wiring and the demands of the environment, not a character flaw. The real root causes of ADHD are complex and based in neurobiology. ADHD often runs in families, which means genes play a big role. However, there's no single ADHD gene. Many small genes add up to increase the chance of developing ADHD in a given person. Since genes are passed down by family members, we often say that ADHD runs in families. It's heritable. If one parent has ADHD, there's a 57% chance that a given child will too, though the symptoms may look different. This chance increases if both parents have ADHD. Twin studies have shown that if one twin has ADHD, their identical twin sibling has a 70 to 80% chance of having ADHD as well. Some early life factors can also raise the risk for ADHD. These include premature birth, exposure to tobacco or alcohol while in utero, and lead exposure after birth, to name a few. This is not an all-inclusive list, but it can give some insight into some root causes of ADHD. So please remember, when we talk about ADHD, we're talking about a real, medically recognized neurodevelopmental condition, not the result of choices, parenting, or willpower.